Hi guys, I'm Anita, a registered nurse, and on this page I'll be teaching about medical and surgical conditions in simple terms. And in today's lesson, I'll be talking about fistula in anal, which is also known as anal fistula. And I'm inspired to talk about this topic because I recently managed a case at my workplace, and I realized this is a condition most people misunderstood. So I'm here to tell you about this case. But before I start, I would want to believe that most of you guys here has heard the word fistula. But to my surprise, many people doesn't even know what it means. So let's dive into the topic. We can talk about anal fistula without first of all knowing what fistula itself means. So what is fistula? Fistula, in a layman's understanding, it's an abnormal connection, an abnormal opening between two body parts which are not normally connected together. Or you can say it's an abnormal passage, an abnormal tunnel, abnormal opening between maybe an organ and the body part, or between two organs, or between two veins and organs in the body. So yeah, different types of fistula, where we have the fistula in anal, we have the obstetric fistula, here we have the vaginal fistula and the rectal vaginal fistula, and then we also have the enterocutaneous fistula and so many of them. Now that we already know the meaning of fistula itself, it will be more easier for us to understand our topic, which is the anal fistula. So let's move on. What is anal fistula? What is fistula in anal? Fistula in anal is an abnormal opening, an abnormal tunnel, and abnormal passage that occurs between the inside of the anus and the skin surrounding the anus. You can as well say that it is an opening connecting the anal canal interiorly and then the skin around the anus exteriorly. There are many misconceptions about this anal fistula. People have their own different beliefs about these conditions, and that's why I am here to correct that impression. Most people believe that it is caused by maybe a witchcraft attack or causes, but that's not true. An anal fistula is a well-known medical condition that is linked with anal abscess. That is infection with pus. Many people they see anal fistula as an ordinary boy, especially when the boy keeps swelling and busting, will tend to like not reach out for medical aid because they believe it will go on its own. Any recurrent boy should actually be a major indicator that this is a fistula. People believe that antibiotics is enough to treat anal fistula, but that's not true. What antibiotics will do for you as a person experiencing those symptoms is to reduce the infection. But then trust me, if you don't go through the right methods to get rid of that condition, you will continue to have recurrent infection. And then has believed that the right treatment for this case, which is the surgery, might lead to one losing his or her bowel control, and then the person might actually start urinating or defecating on his or herself without control. But that's not true. The main aim of this surgery is to remove that abnormal opening. So let's move forward to the causes of anal fistula, and then there are many causes of this condition, but the main cause is known as anal abscess. This is infection with pus. This is maybe when you keep having boys around or near the anus, boys with pus and then so on. Other causes like STI, but this is in rare cases. You have causes like injury or trauma to the anus. You have other causes like tuberculosis and then or even previous surgery, and can cause that too. How is this condition being diagnosed? How has it been diagnosed? Normally it's been diagnosed by a health personnel, especially usually the doctors. Maybe through ultrasound, digital rectal examination. This is where the doctors have to like insert a finger into the anus to check for an abnormal tunnel. It can also be diagnosed through a physical examination, maybe something like examination under anesthesia and so on and so forth. Then what is the treatment for this case? Just like I've said earlier, antibiotics will not heal your anal fistula. Anal fistula on its own will not heal completely. So the correct treatment for this is surgery. So please do well to seek for surgery. Let's talk about the possible complications of these conditions if left untreated. There are quite different complications of these conditions if left untreated, and this might include a persistent pain to the anus, recurrent infections, recurrent boils. Okay, so what are those things a patient might experience during a recurrent stage after surgery? Okay, a patient that's undergo surgery for this case might actually experience different things such as six baths, a night pain, a wound dressing. Please note, as a medical practitioner performing a wound dressing on any patient who has undergone this surgery, please endeavor to maintain a sterile field when doing this wound dressing in order to avoid infecting the wound. And also, a patient might actually experience a gradual recovery, maybe within like 2 weeks or thereabouts. So I think I should call it a day. I think I've come to the end of this lesson, and I hope you learned something. And I won't cease from telling you to stop ignoring symptoms your body keep warning you of. Please, as much as possible, to visit the clinic if need.